I'm Naoki Wada from Asahikawa Medical University from Japan. My title is Can Uroflowmetry Pattern Predict the Detrusor Underactivity of Outlet Obstruction in Male Patients with Lower Urinary Tract Symptoms? We have nothing to disclose. A wide variety of curve pattern on uroflowmetry is traced depending on the condition of detrusor contractility and outlet obstruction. There is no internationally accepted definition of how to interpret the curve pattern in adults. A recent literature shows that the sawtooth and interrupted pattern on uroflowmetry was strongly correlated with detrusor underactivity. So we collect the data of 100 patients who were evaluated using uroflowmetry and pressure flow study. Obstruction and detrusor underactivity were diagnosed based on BOO index and BCI. Other than the conventional parameter, such as maximum flow rate or boiling time or time to Qmax, we evaluated the slope to first peak and maximum drop, the number of notches, the number of curves. The sawtooth pattern included several notches on the curve, and the interrupted pattern consisted of the several curves. The Group 1 and Group 2 included the patients only with obstructions and only with detrusor underactivity, respectively. The sawtooth pattern was more common in Group 2, but the prevalence of interrupted pattern was similar between groups. The conventional parameters, including post-void residual, maximum and average flow rate, voiding time, and time to Qmax, was similar between groups. Age, prosthetic volume, the slope to first peak, the number of notches, and the maximum drop were different between groups. So we conclude that sawtooth pattern is more common in patients with detrusor underactivity than in those obstruction. New parameters on uroflowmetry curve pattern could be helpful to evaluate detrusor underactivity and obstruction without invasive urodynamics. Thank you.